I read some papers looking at how the Greek philosophers had looked at food and noted that many of them referred to obesity occurring in particular tribes. And then I started to look at some Roman literature, and I found again that the Romans had quite an extensive literature on food in general, but on obesity, in fact, saying that they were too fat to fight and so forth. As I probed into it, I found that right throughout history, wherever man has been wealthy, he or she has been fat. And it was a disease of the affluent at the time. But basically speaking, it did not remain flat and suddenly happen in the 1980s, as has been said in some popular books. Now, it's fair to say there has been an explosion in obesity recently, so every corner of the globe has it, that maybe didn't have it before. I look at processed food and I think of bread being a processed food, butter, yogurt, cheese, all of the hams and sausages that were part of Europe, European cities. In fact, it's really difficult to see a food that was invented in the last 50 years that was uniquely to this particular time. Most of them were developed a long time ago, including soft drinks, including biscuits, including cakes. What really happened was mass production. We got the provision of food everywhere, and we also got more and more cheap food and more money to buy food and less time to work for the food. So I would say it was the socio-cultural changes that have contributed more to obesity than any invention of processed or ultra-processed foods. Well, I think that the big industries have absolutely no choice but to invest in reformulation, and to the point where they may have to drop lines that can't be reformulated anymore, and they don't meet certain nutritional standards. So they have to be willing to lose money on those. The smaller industries have to be brought to the table to do it, and the only people who can do that are governments. The problem with the top-down is it's cheap and easy. The bottom-up is much more complicated, much more long-term, and much more expensive. And the bottom-up approach really requires some sort of independent agency to be established with a view to taking this program on for the long term. The top-down, the banning of, or say the introduction of obligatory labelling, the banning of advertising of foods at certain times, the restriction of the building of fast food outlets, these are all easy to do, easy to implement, cost very little, are enormously popular, but in my view, they're not going to solve the problem. We have to help people lose weight. One interesting possibility is that in the bottom-up approach, you wouldn't necessarily target obesity. You would target diabetes and hypertension. And so your targets would no longer be, we want to get people skinny. Our targets would be, we want to get rid of the problems. The issue of diabetes and obesity varies globally. Some parts of the world, the diabetes arises at later stages of obesity, and in some areas it arises at lower stages of obesity. In Asia, it arises at lower stages of obesity. So it would make sense to me in Asia to run programs which not only target obesity, but specifically target type 2 diabetes, because That is what hurts people when they get fat. That is what costs the health service money. And since it's a treatable condition, treatable by both physical activity and reduction in body weight, I would say particularly by physical activity, then I would be definitely targeting. If I lived in this part of the world, I would definitely be targeting diabetes.